All right. Welcome to the second part of dental anatomy practice. So we're going to continue. Last time we ended from we did question 1 through 10. Now we're going to finish from question 11 through 21. Okay. So this is the second part. If you did the first part, that's good, and so you have more practice here to do. All right. So the question 11 of 21. In a normal dentition, the most vertically. So here I usually highlight the most important phrases. Okay, so you can focus on that and make sure you don't focus on something else. So in a normal dentition, the most vertically aligned teeth are permanent. So is it permanent? Is it permanent maxillary molars? Is it mandibular molars? Is it maxillary and mandibular canine? Or is it maxillary and mandibular premolars? Okay, so here is the most vertically aligned teeth in the mouth it has to be premolars. Okay, premolars are the most vertically aligned. Usually, I try to teach some of our medical colleagues. Sometimes you have a patient who is on the ICU and in the surgical intensive care unit, and they put an intubation tube in the midline. And you know that the maxillary central incisors are the most axially inclined teeth. So what the intubation tube does is actually causes those teeth to be mobile, become loose, and ended up being extracted. So usually we advise the respiratory therapist to place the tube in the premolar region, because these teeth are vertically aligned, so they are not able to be laxated easily. Okay. So answer is D. Question 12 of 21. The incisor edge takes an oblique course. I should have highlighted here oblique course, appearing as if twisted. So also highlight twisted, okay, around the long axis of the root. This most succinctly describes so you have to know dental anatomy here. You have to look at the teeth, okay. Mostly when you look at, you can look at the plastic teeth, but usually it helps to look at the natural teeth, okay. So is it the maxillary lateral incisor view? Is it the mandibular first premolars mesial view? Is it mandibular central incisors distal view? Or is it the mandibular lateral incisor view, or mandibular first premolar occlusal view? So I'll tell you, usually the mandibular lateral incisors, they appear as if they are twisted on their root. So here the answer is going to be D. Okay, so here the answer is D. All right. So the next question is, so I hope you've been practicing and reviewing, the dental anatomy, okay? You can read all you want, but the most important thing is you have to practice. Practice. Try to practice every day. Do some questions every day, okay? On the permanent mandibular molars, the lingual height of contour is located, okay? So where is the lingual height of contour? So last week I tried to put same questions in the same area. So if you're reviewing height of contour, so that you're able to answer the questions. So where is the lingual height of contour of the permanent mandibular molars? Okay, is it in the cervical thread. We also saw this question was there was another question in terms of maxillary height of contour. So if you reviewed last week's video, you should be able to know this question. So where is the lingual height of contour of the mandibular molars? Is it in the cervical third? Is it at the junction of the cervical and middle thirds? Is it in the middle third or is it in the occlusal third? Okay. So as we mentioned last week, remember that we mentioned that most of the height of contours of the molars, okay, is in the middle third. Okay, so here our answer is going to be C. Okay. Going to question 14 of 21. Let's see here. Okay, there you go. So question 14 of 21. Which axial surface of the crown of mandibular canine is almost parallel to the long axis of the tooth? So which axial surface of the crown of mandibular canine is almost parallel to the long axis of the tooth? So you have to know, I love mandibular canines. So they are usually, they have long crown. So you have to know which side is mostly parallel. Okay. So usually the mesial side is mostly parallel to the long axis. Okay. So the answer here is going to be A. So if you know the anatomy, you really have to, instead of just memorizing words, you also have to look at the actual teeth. Okay. It makes it very easy. So answer is A. In which of the following teeth is dens indente most likely to occur? Of course, you should, if you shouldn't miss this one. Okay, you shouldn't go in this exam not knowing morphologies of the, and then also the variations in anatomy of lateral incisors. Okay, maxillary lateral incisors, you should know them really well. Okay. So, of course, I already mentioned the answer is this. It's maxillary lateral incisors. Okay, that's our answer here. So the answer is E. So this is like a freebie. Okay, all right. So going on to question 16. So here I highlighted in red. So in many cases, the central developmental groove of a maxillary first premolar will cross the, okay, in many cases, the central developmental groove of maxillary first premolar will cross there. So you have to know maxillary premolars. You have to know their anatomy. Okay, remember that they have a mesial concavity, and you have also the groove which extends onto the mesial concavity of the so crosses the marginal ridge onto the mesial concavity. All right. So here I already mentioned the answer. It's the answer is going to be the mesial marginal ridge. Okay, so A is the answer. All right. So 17. The closal outline of a permanent maxillary first molar contains two obtuse and two acute angles. The acute angles are the, so you have to know, this is a question we have to know the angles, okay? Which ones are the acute angles? All right. Is it the mesiolingual and the distal lingual? Is it the mesiofacial? So here I'll tell you, if it has if the answer is a mesiolingual, remember the on the maxillary first molars, the mesiolingual cusp is a large cusp. It has a large angle. So if the answer has mesiolingual, just remove it because that's not going to be an acute angle. So mesiolingual, A has mesiolingual is out. C has mesiolingual is out. So A and C are out so far. So we have B and B, D, and E. Okay. So mesiofacial and distolingual. Is it mesiofacial and distofacial, or is it distofacial and distolingual? Okay. So our answer here is Mesiofacial and distal lingo. So B is the answer. Okay. So you have to look at the anatomy of the occlusal surface of the first molars. Okay. So 18 of 21, the cusp of color belly. Well, you should know this one. So meaning you have to know first molar as well. Make sure you know the cusp of color belly. So the cusp of color belly of the permanent maxillary molar is located in where? Okay. So it's on the mesiolingual lobe of the first molar. Okay. The mesiolingual, so meaning it's on the side of the mesiolingual cusp. That's why the largest cusp. That's why the cusp of color belly is attached. Okay. So B is our answer. 19. The only premolar which frequently has a central pit is there. So which premolar has a central pit? So you have to know the morphology of premolars. Okay. You have to know the which premolars have anatomy which can look like a canine. Okay. Usually that's like a first premolars. Which premolars has variations of like U type, H type, Y type. Those are the second premolars. Okay. Remember the Y type ends up having a central pit. Okay. So here is going to be the answer is going to be the mandibular second premolar. To be specific, the Y type. Okay. So answer is D. All right. So question 20 of 21. Mandibular canine viewed from the mesial aspect may be differentiated from maxillary canine in that, well, you should know this already. The previous question say that it's more when you look at the mesial surface, it's more like almost parallel to the long axis of the mandibular canine. So that means its cusp, okay, the cusp of mandibular canine will be lingual to a line bisecting the root, okay, because one surface, the mesial surface is straight, the distal surface is curved. So when you bisect the midline, the tooth into half, okay, it means they're not going to have equal parts. So the cuspid is going to be more of on the to the lingual, okay, to the lingual side of the of the of the tooth, okay. So answer is going to be A. So 21, which is our last question. So the transverse groove of the oblique ridge of a permanent maxillary molar connects which of the following pits? The transverse groove of the oblique ridge of a permanent maxillary molar connects which of the following pits? Transverse groove, okay, of the oblique ridge of permanent maxillary molars connects which of the following pits? Does it connect the distal, okay, the distal facial, or the central and the distal facial? Is it central and the distal, or is it central and the mesial, or is it central and the lingual? Okay, so here you have to know the anatomy. So usually it's a central and the distal. That's how the oblique ridge runs. Okay. So answer here is C. Okay. So make sure that you review this. Don't just look at the answers and try to memorize the answers. But dental anatomy. Remember, the beauty of anatomy is that it's something which is fixed. So if you know the anatomy, it won't change. Make sure you look at the teeth themselves and understand. It's like driving. The first time you drive to a destination where you don't know, you may need a GPS. The second time, you need a GPS, but you don't need it much. The third time, you need a GPS. The fourth and fifth and the 10th time, You may drive to the place without even, recognizing the streets that you pass. You just realize that you are there because you already know. It's already imprinted in your brain. Okay, so it's the same as dental anatomy. Just make sure you review it well, and every day do some practice questions. Okay, all right. So we'll end here for today, and good luck.